All nightlife spots that have pivoted to F&B must close for 2 weeks, and all employees will be tested for COVID-19 during this time. Around 400 of such businesses have made the switch since October last year, but authorities are getting tough on them amid a growing KTV cluster that now has 120 cases. Chloe Chu joins us with more. Now, Chloe, beside the closures, what are the other measures to curb the spread of the KTV cluster?
So I'm standing along Sophia Road now. The building behind me is home to many KTV outlets and operators, as you can see from the signboards. Some of them would be a part of the impending closure. So as you mentioned, the KTV cluster, it's growing. More than 2,000 have already been quarantined, including staff and patrons, and this number is only set to grow. So during the 2-week closure, the government will check on these establishments and make sure they have the right safety protocols and safe management measures in place. Only when these safety measures are of high standards would they then be allowed to reopen once again. So during the Ministerial Task Force press conference earlier, the panel was actually asked a question. They were asked whether this entire saga could have been prevented through stricter enforcement measures. Minister Lawrence Wong took the question.
It's not just in places like these. We know of illegal gatherings outside of KTV lounges. It has happened at homes. It has happened in hotels. It has happened in restaurants. It has happened even in warehouses. So I assure you, the enforcement agencies are stretched. They are working round the clock, pursuing every lead that they receive. But we appeal to everyone, please do your part. And if you know of others who are breaking the rules, let us know. And we will collectively, let us remind each other to be responsible individually and as a society.
Chloe, this is yet another setback for the nightlife industry. What other challenges do the night spots face moving forward?
So Mr. Wong also said, the nightlife industry, it comes with a certain set of challenges in itself because, number one, people move around very frequently in this industry. And number two, it's a bit of he gave a cat and mouse analogy in that sense. So you can't have regular safe distancing officers or enforcement officers just going in because once the patrons, the staff see them entering the compound, they would just return to their seats and everything will look normal. So he said it would take a different kind of enforcement in that sense. So perhaps plainclothes officers or special operations to crack down on these establishments. He also added that the onus now is very much on the Nightlife Association to show the public that they can get their act together and really just build the trust again and behave. I spoke to the association earlier, and he says it's very unfortunate because actually many of these businesses, they genuinely want to pivot to F&B to survive in the current climate. And it's just because of this small number of people that they're getting penalized. But let's hear what else he has to say.
We definitely have to tighten up on people who claim that they have actually pivoted but actually did not. I think previously what we were doing was just to catch them during those period of time where they actually flouted certain rules and we sort of give them a 10-day penalty and all that. Maybe the authorities will want to consider a much harsher penalty.
He also hopes that after these 2 weeks, it could be sort of a fresh start for the industry in a sense. So he wants the word from all these establishments that they will keep to their promise of operating as F&B and not doing any other kinds of business. Only then can the industry reopen safely once again.
All right, thanks, Chloe. Chloe Chu there, reporting live. Well, at the centre of the KTV cluster is a Vietnamese woman on a short-term visit pass. She was the very first case to be reported from this cluster. Her household contacts and boyfriend have also since caught the virus. Well, the Health Ministry had earlier said it was investigating a group of Vietnamese social hostesses who frequent such lounges when the cluster first emerged.
She has been in Singapore for a while, and it's extremely likely that the seeding of the cluster arose as a result of an initial community spread, although where that came from and the mode of transmission is still as yet unknown.
And so authorities are now building 4 so-called rings around this index case to contain further spread. Now, the first ring comprises staff and patrons of the affected nightlife joints. Roughly 2,400 people are on quarantine. They'll undergo multiple COVID-19 tests throughout the process. The next group are staff and patrons not captured sufficiently under safe entry and trace together data. So far, 25 of the 1,660 people swabbed have been positive, although those negative may still be incubating the virus. Now, the third group are the roughly 2,000 contacts of the confirmed cases. They may not have visited the KTVs, but were picked up by Trace Together. Health risk warnings are issued to them via SMS, and they must get tested and self-isolate. The last group are those who were near the affected karaoke joints. There may be over 10,000 of these people, and they'll get health risk alerts and told to monitor their health. Now, going back to those infected, authorities say there are 3 groups in this cluster. The first group, visitor pass holders or foreigners who visited multiple KTVs, some on the same day. Now, many could be social hostesses or staff in various roles. There are also regular patrons who are mostly Singaporeans who frequent these places. The last group are household contacts. Only 6 in the cluster are fully vaccinated. Most of them are young. The Singaporeans are aged 19 to 60, but authorities are worried that the spread may reach the elderly at home, especially from likely cases who don't come forward. Around 140,000 of those aged 70 and above in the country are not vaccinated.
In the coming weeks, we are going all out to try to reach out to this group of seniors in order to protect them. So I hope out there, anyone who know any seniors unvaccinated, please help us persuade them. The benefits far outweigh the costs.